Okay, thanks for joining. This is Ed. It's 1 o'clock. I'm going to kind of ramble on here for a minute just so other people can come on. But today we're going to talk about Medicaid and drug help and how they coordinate with Medicare Advantage plans, PDPs, and MedSups. A couple house cleaning items before we get started. Since we just had a couple new people come on, I record all these webinars. If for future reference you want to attend one, we usually do them on every Wednesday and Thursday. If you like the topic but you can't make it at the time, just register and we'll send you the recording. Any questions you have today during the webinar, please just send them in to the webinar and I will answer them at the end. I'll hopefully answer them at the end for you. And having said that, I think we'll get started. This should run about, I didn't do a practice run through on this one, but I think probably about 20 minutes. So having said that, let's get started. So we're going to talk about Medicaid and drug help. There is a difference between the two things. We will talk about the difference between those, difference between Medicare Savings Program. When I write MSP, that stands for Medicare Savings Program, so the difference between that and Medicaid. Talk about people who are QMB. Again, when I say QMB, it's QMB. QMB Plus, which is technically Medicaid, versus a QMB only. Talk about balance billing for QMB and Medicaid. That's a big topic and gets very confusing with doctors' offices, clients, everybody. And then we'll finish up basically talking about how Medicaid and MSP programs coordinate with MAPDs, dual plans, PDPs, and supplements. So I just made that sound like it's going to be easy, but again, this is a big topic, but I'll try to keep it fairly straightforward. Again, we got a couple new people coming on. If you have questions, just please send them into the webinar along the way, and I will try to answer them at the end for you. Okay, so let's talk about Medicare Savings Program. You'll hear me say MSP for the acronym a lot versus full Medicaid. So all these terms are intermingled often. Depending on the state you're in, who you talk to, they will say MSP versus drug help versus Medicaid. You'll hear QMB versus QMB Plus versus Medicaid. In some states, Medicaid has a different name. It gets confusing, but I'm going to just talk about the different levels, and if you can, we can hopefully simplify them a little bit that way. So, talk about Medicare Savings Program versus full Medicaid. So, Medicare Savings Program is used to describe the levels of help below full Medicaid. Again, just not to get confused, sometimes you'll hear somebody talk about Medicare Savings Program when they're talking about Medicaid. Technically, they shouldn't be doing that, but they will a lot. Well, so whatever works for people, I guess. But Medicare Savings Program is the level below full Medicaid, and it is set with 4 different acronyms which describe the 4 Medicare Savings Program levels. You have QMB, so you'll hear me say QMB a lot. QMB is you have full Medicaid, which is a QMB Plus, but then you have Medicare Savings Program, so that's below full Medicaid. That's a QMB. We'll talk about that. SLMB, QI, and in some states, ALMB. And as I mentioned, to make it a little more confusing, you'll often hear Medicaid called QMB Plus. So these programs provide coverage for the cost share on Medicare-approved benefits. So whenever we're talking about Medicaid or a QMB, or any of these programs, they only cover stuff that is approved either by Medicare or stuff that is approved by a Medicare Advantage or PDP. That'll be important in a minute, and we'll talk about it. These programs are all funded by the government, but they're administered by each state individually. That's why you see different income levels, different income thresholds for these programs by state. A lot of them default to the federal guideline, but some of them, like the state I'm in, Connecticut, they've decided to have much higher income allowable amounts for these programs versus what the federal guideline is. Okay, so when we're talking about any of these programs, Medicare Savings Program will not cover benefits that Medicare does not cover at all. So if somebody is on a Medicare Savings Program level, let's say a QMB, they're not going to get coverage for preventative vision, dental, non-skilled home care, transportation, incontinence supplies. There's a huge list of things. So if somebody's on original Medicare, and let's say they're a QMB, people will incorrectly think that QMB is going to cover these benefits when it won't, because original Medicare is not covering them. Same thing goes for a Medicare Advantage plan. Let's say you have a Medicare Advantage plan and you have one of these levels. It's only going to cover things that the Medicare Advantage plan approves. So if somebody, for example, on the drug help piece, if somebody wants to get, is looking for the state to step in at one of these levels and cap the drug cost, it's only going to work if the drug's in the formulary of the plan. If it's a non-formulary drug and you got them in an Advantage plan, the state's not going to help either. So just so we can be clear on that piece. So that leads us into the levels of the program. So QMB plus Medicaid, that is Medicaid. So full Medicaid means that person gets Part B help with their premium, they get copay help, they get all the benefits that you're used to on a Medicare savings program, and then they get additional stuff too. So a full Medicaid will also get dental, vision, the kind of things that you see promoted on the Advantage plans. Full Medicaid gets those. A QMB, however, is one level below full Medicaid, and a QMB gets their Part B premium paid, they get drug help, they get copay help, but they don't get dental, vision, those kind of things. And in a minute, you'll see why that dovetails in nicely with an Advantage plan, a dual Advantage plan that's offering those kind of benefits. The other levels, SlimB, QI, and ALMB, ALMB is not available in every state. They're providing Part B premium and drug help only. I'll talk about that more in a second. So first of all, when we're talking about all these programs, all of them provide drug help. So all programs qualify for prescription drug help, and that means when you have drug help, they'll cover the drug premium for a standalone PDP, or if it's a Medicare Advantage plan with a premium, they'll cover that premium. However, they will only cover it up to the benchmark. Benchmark is different on every state. The benchmark premium changes. It ranges from $22 to $47 depending on the state you're in. And that, to give you an example of that, if you enroll somebody who's on one of the levels of MSP into a standalone drug plan, and let's say the benchmark premium in that state is $30, MSP is only going to cover up to $30 a monthly premium on that plan. So if you put them in a $50 a month plan, they're going to have a net balance of $20 a month they owe, because the help program's only going to cover up to the benchmark. And again, the benchmark's different for every state. Tend to see that states out west and down south, they'll have lower benchmarks, maybe $22 is the lowest, versus like a New York that goes up to $47. So at any of these levels of help, the cap on prescription drugs is $370 on generics. So if somebody's taking a generic drug, it caps that cost at $3.70. Really, the more important one is the cap on brand name medication. It puts caps on brand name medication of $9.20. Now, if somebody has full Medicaid, these caps will be lower, but it will never be higher than this. And these caps work even in the donut hole. All levels of these programs also cover your Medicare Part B premium, even if they have a penalty. So if somebody's got Medicare Part B and they have any of these levels of coverage, they're not going to pay that Part B premium. If they had a Part B penalty, they won't pay it. They won't pay their drug plan premium up to the benchmark, and on the copays, they'll be capped even in the donut hole. That is for, just to go back for a minute, that's for all these levels. QMB and full Medicaid, QMB only, SLMB, QI, and ALMB. I'm going to go over the income levels for those in a minute. So let's talk about QMB and QMB Plus. So if somebody's a QMB or a QMB Plus, so they're QMB or they're full Medicaid, that's going to pay for their Part A premium, even if they don't have free Part A. And like all the levels, it's going to pay for their Part B premium. It will pay for A and B penalties as well. So if somebody's penalized and they're a QMB or QMB Plus, they're not going to pay for A penalties, or B or B penalties. It's going to pay for their drug premium up to the benchmark. It's going to limit their copays even in the donut hole, as we talked about. And if they have a late enrollment penalty for Part D, it's going to cover that penalty as well. So again, on the Part D piece, all levels of MSP do that. But when you're a QMB or a QMB Plus, full Medicaid, when you're one of those levels, it's also going to cover their Medicare cost share. So if they're on original Medicare and a drug plan only and they're a QMB or QMB Plus, they're not going to pay copays or cost share for any medical services they receive. The only way they'll pay for that is if it's a service that they get that Medicare doesn't approve. then they'll pay, because the state won't help if Medicare doesn't approve it. Same thing goes with Medicare Advantage, and this is a big misconception sometimes. People think that a Quimby or Quimby Plus level will only help with copays on a dual plan, which isn't the case. Quimby or Quimby Plus will pay the copays for duals. It'll also pay the copays on a regular Medicare Advantage plan. So whatever benefits are listed on the Advantage plan, maybe a deductible or copays for various things, the QMB or full Medicaid will cover those copays. They will have no copays, whether a regular or dual MAPD plan. They also won't pay copays for, like if they have a deductible on the Aetna Elite plan, the $1,000 deductible, that would be paid. Any drug deductibles would be paid. The only exception to this rule is if you enroll somebody in a dual plan or a regular Medicare Advantage plan and they go to a doctor that isn't in the network of that Advantage plan, then they're going to have issues because the doctor's got to be in the network that they're seeing. If the dual plan or the Advantage plan happens to be a PPO, the QMB is still going to cover it. The doctor will probably try to balance bill them, but as we'll talk about in a little bit, they're not allowed to. So again, QMB and QMB Plus, they're going to have everything covered. Drugs, penalties, copays, donut hole, they're going to get full-fledged coverage at those levels. Let's see, I already talked about that one bullet point. Okay, so regarding medications, so if somebody's a Quimby or Quimby Plus, and this goes for every level, again, and I mentioned it before, you got to be careful. If you put somebody in an Advantage plan or in a PDP, their medication must be in the formulary for these programs to help cover that drug. If they're not in the formulary, these programs aren't going to help either. So the state, who's always the payer of last resort, they're not going to help if it's out of formulary. Okay, so we'll talk about SLMB and ALMB. SLMB and ALMB is based on income again. So if somebody makes too much money to be a full Medicaid or a Quimby, they might fall into the SLMB or ALMB level. That's going to cover drugs the same as every other level. It's going to cover their Part B premium and penalties, just like any other level. The only difference is at these levels, they won't get help with their costs and copays, medical costs and copays. Here's where we get variable. Keep in mind, some of these levels don't allow for asset limits or don't have asset tests. Some states do. So some states will allow higher income as well on the ALMB. Some states won't. And again, it just depends. The best advice I can give you there is just to Google Medicare Savings Program income limits for your state. So if I was checking Connecticut, I would Google Medicare Savings Program income limits Connecticut or MSP income limits Connecticut to get the limits in a given state, as they may be higher than the federal minimum. Some states also don't have asset limit tests on the ALMB. ALMB is the lowest level. For states that offer ALMB, some states have asset tests on it, some don't. Connecticut, for example, does not have an asset test. So at the ALMB level, which pays your Part B premium and helps on all your drug copays, at that level, if they make below the income allowed, it doesn't matter how many assets they have. And then also keep in mind, some states have additional programs like state pharmaceutical assistance programs. And an example of that would be Epic in New York. That is completely separate from everything I'm talking about. They have just built another program in. For example, Epic is a drug help program, and you can make up to $100,000 and still get it. There's various extra programs like that, and they'll usually fall under the name of a state pharmaceutical assistance program. There's Jersey Care, for example, in Jersey, or PAD rather in Jersey, PAAD. But a lot of states have additional programs that allow for higher income than the Medicare savings programs do. So I listed here the national income limits for Medicare savings program. Again, some states are much higher. Connecticut, for example, is much higher than this. Just depends on the state you are in, but a lot of states default to the national level, which is listed here. So somebody's a QMB, you can see the income limits for an individual or a married couple. And they also have, most states will on QMB have asset limits, as you can see here on the grid. Again, a state like Connecticut, there is no asset test for QMB. full Medicaid there is, QMB plus, but a QMB. And remember, the QMB level will pay Part B premium, it'll give you drug help and pay copays. And again, in most states, there's an asset limit. In Connecticut, for example, there isn't. But that's the most an individual can make and still be a QMB from the federal guideline, which most states default to. So QMB is drug help, Part B premium help, copay help. SLMB is drug help and Part B premium help only. Same thing for QI. And then QDWI is for people who are disabled. Obviously, that's much higher, those income thresholds. The one I didn't list on here because it's not available in a lot of states and because the income range is so variable is the ALMB. So again, in some states like Connecticut, California, you have the ALMB level that allows for much higher income. For example, in Connecticut, ALMB, which will still give you pay your Part B premium and give you drug help, ALMB has a limit of $2,600 a month, for example. But these are the limits. Okay, let's talk about billing for a minute. So I'll give you a situation. Let's say somebody is on a Medicare Advantage plan, they're a QMB. So remember, QMB covers drug copays, Part B premium, and medical copays. So they go to a doctor who's in network on the plan. Doctor says, okay, you owe me on a non-dual, an MAPD plan. They go to the doctor. This person has QMB as well. Doctor says, all right, you owe me a $45 specialist copay. And they say, well, no, I have state help. And the doctor says, yeah, but I don't take state. Well, it's against the law, actually, for that doctor to bill them just because they don't take state. They can't balance bill. It's not allowed. They'll certainly try a lot. The reason I put this in there is so you can see it. Federal law forbids Medicare providers and suppliers, including pharmacies, from billing people in the QMB program, even if they don't accept state. So people in the QMB program have no legal obligation to pay Part A or B deductibles, copays, cost shares. However, as the second point bullet here describes, doctors will try to do it all the time. So if you've got somebody who's a QMB in an Advantage plan, non-dual plan, or even a dual plan for that matter, the doctor says, I don't take state, you owe me a copay. They don't. The doctor has no legal bearing to get the copay from them. The only risk they run in that situation is ultimately if they push hard enough, the doctor will say, yes, you're right. You don't owe me a copay, but also I'm not going to see you anymore. The doctor doesn't have to see them going forward, but they certainly can't get the balance bill or the copay out of them. Comes up a lot. You'll run into this often. Okay, so if somebody gets one of these levels of drug help, there's special elections for having those levels. So anybody that is a current Medicaid, QMB Plus, or any of the other drug help levels, they have a special election. They can use it once a quarter, and they can use it for the first 3 quarters of the year. So you get one election in the first quarter, second quarter, and third quarter. That's for existing people on those levels of help. And during that time, they have a special election each quarter to change to whatever they want. Maybe they're in an Advantage plan and you want to change them to another one. Maybe they're in an Advantage plan and you want to move them to original Medicare, a supplement, and a drug plan, or you just want to switch drug plans. You can do anything you want once a quarter, but only once a quarter. Existing people with drug help can't make a fourth quarter change, and we get that all the time. So once you hit the fourth quarter, they have to use their AEP election to change for January because you can't use your drug help special election to make a fourth quarter change. Now, what if they're new to drug help? Well, it doesn't matter when then. If they're new to drug help, they have a special election because they're new. They have a special election anytime in the first 3 quarters, and they even have one in the fourth. So if you meet somebody in November and they're like, hey, I just got ALMB, or I just got drug help from the state, or I got a gray card, you can move them first of the next month, even though it's fourth quarter, because they're new to drug help. When I say the first 3 quarters, that only applies to people that are existing drug help people. So this applies to Medicare Advantage, dual and non-dual, and drug plans, standalone drug plans. You will notice on applications when you look at supplements, so we'll talk supplements for a minute. People on med sup certainly qualify all the time. You'll have somebody who gets a level of drug help who's on a med sup. If they're a QMB or lower, you certainly can put them on a Medicare supplement plan. And that QMB level will pay for their standalone PDP, and it will help with any cost share left over from that supplement. If they're a QMB plus full Medicaid, that's when you're not supposed to put them on a supplement. So if you notice on supplement apps, it'll say, is this person on Medicaid? Well, if they're a QMB plus Medicaid, then yes, they are, and you're not supposed to enroll them in a sup. However, if they're a regular QMB or any of the levels below, you certainly can put them on a supplement plan because it's not technically Medicaid. I get the question a lot. Since a QMB, full Medicaid, you can't put on a supplement, but a QMB, you could put on a sup, but since a QMB is getting copay help anyway and help with their Medicare cost share, should you put them on a supplement? Well, usually you wouldn't, but you do get it once in a while. I do get situations where people want to be on a QMB even though they have a supplement, or they want to be on a supplement even though they have QMB. It's not common, but you'll see it once in a while. But technically, if that supplement has cost share, the QMB will pick up what's left over. But if they're on like a Plan G, for example, it probably doesn't make a whole lot of sense. If they're a QMB, you'd probably want to look at an Advantage plan for them because they won't pay the copays on the Advantage plan. So again, any of these levels, the help will apply to a standalone drug plan up to the benchmark premium. And now I finally put it in the slide there, ranges from $22 to $47 a month benchmark premium depending on the state you're in. So takeaways on this. When it comes to help, QMB plus Medicaid or QMB will pay copays and cost share, both for regular MAP or dual plans, both. All levels of these programs come with drug help and pay your Part D premium. And the drug help will coordinate with any kind of PDP, MAPD, or dual MAPD plan. The key is the drug has to be in the formulary. If you put somebody who has an ALMB maybe or a QMB in a Medicare Advantage plan, whether it be dual or not, they have a drug that isn't in the formulary, that drug is not going to be covered by the state then. Again, as we talked about, providers cannot balance bill members with QMB plus or QMB. They're not allowed, even if they don't take state help. Even if that provider is not participating with Medicaid, they still can't balance bill. However, there is a likelihood that once they're pushed on it, yeah, they'll say, you're right, you owe us nothing, but don't come back. That can certainly happen. Okay, so QMB plus in QMBs, so full Medicaid or QMB, they have an out-of-network plan. Maybe they have a dual PPO or a regular MAPD PPO. They don't pay the cost share out of network, out of state. So common conception there is, well, if I'm a QMB in New York or in Connecticut or whatever state, and I'm in a different state, and I'm in a PPO plan, so the doctor's out of network, but it's a PPO, or maybe the doctor's in network in the national PPO. Since the QMB I'm in is specific to Connecticut or New York, for example, where I live, that QMB will not pay for my cost share in another state. It actually will. So if you're in a PPO dual plan, you've got out-of-network coverage, or you're in a PPO dual plan and you're seeing a doctor in a different state that's in the network, the QMB will coordinate. The only way it wouldn't is if you're in an HMO dual or an HMO MAPD and you see an out-of-network doctor and the plan has no out-of-network coverage, then QMB won't help. I do see we have some questions accumulating here. I certainly will try to answer them as soon as we get done in just a minute. Okay, so one distinction to make here is when you get somebody on full Medicaid people do get access to dental and vision and the extra benefits not covered by Medicare. However, a QMB only, they might get copay help, have their Part B premium waived, and get drug help, but they don't get those extra benefits as a QMB only. So that's where a Medicare Advantage plan might look really appealing to them because you'll be giving them dental, vision, over-the-counter transportation, things that a QMB doesn't get. So that's a big sell for you there because you can give them those benefits. Even people on Medicaid, a lot of times those benefits will be attractive to them because maybe they don't want to go to just a Medicaid-approved dentist or vision provider. So it might be attractive to a Medicaid person, but it certainly will be even more attractive to a QMB. Keep in mind, though, that all dual plans don't accept QMBs. There are some dual plans out there that are full Medicaid-only duals. There are others that take full Medicaid or a QMB. So it's important to know when you go into this. You know, if you're using a company that's full dual only and you got a Quimby, you're not going to be able to enroll them. But a lot of the dual plans now take both. And again, that can be a huge selling point for you. It's important to know and use the extra special election periods available to people with any type of help. One other quick situation I'll give you is, let's say somebody has drug help and you're in the first quarter. They basically have two elections. They have their OEP election and they have their drug help election. So keep in mind, you know, if they've used their OEP election up, they still have the drug help, or vice versa. So it's important to know your elections when you move these people, if you need to move them, to know what elections are available to you. Let me see what we have for questions. I know it's a complicated topic. Let's see here. Okay, so first question is, why would someone enroll in non-dual MAPD if on assistance? Because they'll both coordinate. So I'll give you an example. Maybe the non-dual MAPD, maybe the state you're in only has HMO dual plans, and this person really wants the flexibility of a PPO. So you could put them in a non-dual PPO. The QMB will cover their copays. I mean, it's essentially going to operate the same way as the dual. So you put them in that non-dual PPO because it's the only PPO available is non-dual, and the QMB is still going to cover their copays for them. Or maybe there's a situation which this happens rarely, but sometimes it does, where the non-dual plans actually have better ancillary benefits like dental, vision, OTC than the dual plans do. Happens once in a while. Good question. QMB, same as FBDE. No, QMB is different than a full benefit. FBDE is another acronym for, I'm sorry, no, I'm looking at your question now. Is QMB Plus the same as FBDE? Yes. QMB Plus signifies full Medicaid. FBDE signifies full Medicaid. So yes, they'd be the same thing. The next question is, we know if in PDP you can get help up to the benchmark. Does it affect anything pricing in an MAPD? Yeah, it's a good question. So if you've got an MAPD with a premium, your drug help will help pay for that premium of that MAPD, but only the drug portion of it. And I'll give you an example. Say you got a $50 a month MAPD plan. Out of that $50 a month, the company internally has assigned a portion of that as medical premium and a portion as drug premium. So help will only cover the portion that is considered to be drug premium. So on that MAPD, for example, that's $50 a month, maybe 40 of it's allotted to drug, maybe 10 is for medical. And on that plan, the benchmark premium, let's just make it easy, is $40 a month. They'll pay $10 a month then for that MAPD plan. Usually what I do with that is try to look at zero premium, either full dual plans or either dual plans or look at a zero premium MAPD plan. Okay, so let's see, we got a few more questions here. Those are good questions, by the way. Okay, so if you have a client who's aging into Medicare but hasn't applied for Medicaid right away and then they apply and get approved, will Medicaid pay the person's Part B retroactive when they get approved? They will go back 90 days to pay the Part B premium. So if you've got somebody and they get help, they will go back 90 days from the time they applied. They won't go further than that. So if somebody was on had Part B for a year, at the end of the year they apply for help and they get it, they'll only go back 90 days and they won't go back further than when they applied. So if somebody applied on, for example, November 20th and they already paid their November Part B, when they get approved, they'll go back and pay November, but they won't go back any further than that. That's a really good question. See if we have any other questions. I think that's it. Well, if you have future questions, I'll waste a little time here if anybody's got anything else. If you have future questions, just feel free to give us a call. We'd be happy to talk to you about them. You can call us here at the office. But again, really the takeaways here are you really got to know your income levels on your drug help and your levels of drug help. And one question I get a lot is, Ed, how do I know what level somebody has? Well, it can be tricky sometimes. A lot of the insurance companies will have, well, in fact, most of them do, have numbers you can call in to confirm level and confirm if they can go on a dual plan, especially the companies that offer duals. they usually have a dual assistance helpline you can call to confirm somebody's level to make sure they're eligible for the plan. So if the plan takes full dual and QMB, you can call the number and they'll say, yeah, they're eligible. They have full help. They're eligible to enroll. Barring that, if you just want to figure out what level of help somebody has, the best way to do it is to ask them questions. Say to them, okay, when you go to the doctor, do you pay a copay? If they say, yeah, I pay a copay, but I don't pay my Part B premium, and the most I pay for drugs is $3 and $9, that's telling you they're one of the levels below QMB. If somebody's on an Advantage plan and says, I get help, I don't pay my Part B premium, and my copays, I never pay more than like $9. So I don't pay copays, I don't pay my Part B premium, I'm on an Advantage plan, I never pay more than $9 for a prescription. That's telling you they're a QMB or a QMB plus. So asking questions can be a good way to try to figure out if they don't know otherwise. Okay, so I have the question, how does applying differ? I'm not sure I follow that one. You can take that offline if you want. Send me an email or call us at the office, and we can answer that for you. All right, it looks like that's all we have for questions. I appreciate joining me today. Again, it's a little bit of a convoluted topic, but once you learn your help levels, it comes in really handy when you're out there selling Medicare plans. So, thanks for attending today. We will call you. We will send you a copy of the recording, and appreciate your time. And please call with any questions. Thank you.